It was perhaps a question of when, not if.
We've got to be humble in the face of nature. And in this country, alas, as across much of Europe, the virus is spreading even faster than the reasonable worst-case scenario of our scientific advisors. Unless we act, we could see deaths in this country running at several thousand a day, a peak of mortality, alas, bigger than the one we saw in April.
The second wave threatening to be more deadly than the first. The NHS on the brink. The PM out of options.
The huge exponential growth in the number of patients, by no means all of them elderly, by the way, would mean that doctors and nurses would be forced to choose which patients to treat, who would get oxygen and who wouldn't, who would live and who would die. The risk is that for the first time in our lives, the NHS will not be there for us. And so now is the time to take action because there is no alternative. And from Thursday until the start of December, you must stay at home. You may only leave home for specific reasons, including for education, for work, let's say if you cannot work from home, for exercise and recreation outdoors with your household or on your own, for medical reasons, appointments, and to escape injury or harm, to shop for food and essentials, and to provide care for vulnerable people or as a volunteer.
From Thursday, closure for pubs, restaurants, gyms, almost all shops and leisure settings. But there will be economic support.
We are going to extend the furlough system through November. We will not end it. We will extend furlough until December.
And unlike the spring, schools will remain open.
We cannot let this virus damage our children's futures even more than it has already, and I urge parents to continue taking their children to school.
Not long ago, the PM had hoped for a return to normality by November. Now, on October the 31st, the goalposts are moving.
As I've said before, I am optimistic that this will feel very different and better by the spring. We will get through this, but we must act now to contain this autumn surge. We're not going back to the full-scale lockdown of March and April, but I'm afraid from Thursday, the basic message is the same. Stay at home, protect the NHS, and save lives.
We face a longer lockdown. Christmas is in doubt. The NHS could be overwhelmed. Do you accept you should have followed the scientific advice more closely? And do you regret that you haven't?
We've obviously have to listen to all kinds of scientific advice. We also have to balance that scientific advice with the consequences for people's lives, for people's mental health. I'm not going to pretend to you that these judgments aren't incredibly difficult. They are incredibly difficult.
And if I could just ask Professor Whitty, realistically, is it now too little too late to get us to a place where we will be able to celebrate Christmas with our families?
There is basically no perfect time and there are no good solutions. All the solutions are bad. And what we're trying to do is have the fewest, the least bad set of solutions. In terms of making festivities, whether it's Christmas or any other religious tradition, we would have a much better chance of doing it with these measures than we would if these measures were not being taken today. And I think let us see how this goes over the next few weeks.
Labour frustrated. They saw this coming.
These are the measures we called for 3 weeks ago. The scientific advisors said were necessary back in September. So the government has delayed and did just as in the first phase, where they were too slow, they've repeated the same mistake.
8 months since that first national lockdown, and here we are again. The precariousness of the situation now plain to see, the worry at that press conference today etched on the face of the Prime Minister and his advisors. And the reality for all of us is at least another 4 weeks of lockdown when people are already struggling with frustration and fatigue.
It's absolute madness. They say it's to save lives, but a Great Depression will kill more people than what this virus ever will.
I think it's been a long time coming. Things have got really bad really quickly.
Looking at the scenario, I think it's inevitable that that will happen at some point. So I understand where it's coming from in terms of what he wants to do.
In truth, no one knows if this new set of measures will work or if the public will comply. What the Prime Minister has concluded is that he must act now to try to protect the NHS. But is it all too little, too late? Beth Rigby, Sky News, Westminster.